Sleep apnea is obstructive breathing at night. Basically what happens is when somebody's sleeping, their airway gets obstructed and they can no longer breathe. So they're no longer getting air to the brain, and that can cause a lot of issues in the future. Many individuals are at risk. Now, what you want to think about is a few things. How old are you? Are you over 60? If you are, put one finger up on your hand. Are you a male? If you are, put another finger up on your hand. Do you have a large neck? Are you overweight? Are you being treated, or have you ever been told you have high blood pressure? Keep putting fingers up if you're answering yes. Do you snore at night, and is that snoring loud? That's another finger. Has anyone ever observed you stop breathing at night? If you have multiple fingers up right now, you're at high risk for sleep apnea, and you should definitely ask either your primary care physician or your general dentist. A lot of people who have sleep apnea try CPAPs. The failure rate for CPAPs is extremely high. Now, don't get me wrong, CPAPs are great, they're the gold standard, but most people cannot wear them. They either don't like the sound, they're unable to wear the mask leaks, or they're just not open to trying it. And that's okay. We fill that gap. If the CPAP can't work for you and you just can't wear it, the next best thing is a dental device we can make for you in office. We make a device for you, and these devices come in many different flavors, and it pushes tissue out of the way so you breathe better at night. And we treat here mild and moderate cases, and occasionally the severe case if you just cannot wear the CPAP at all. What we'll first do is we'll check to see if you have already had your diagnosis. It's very important before we start making a mandibular advancement device that you've already been diagnosed with sleep apnea. So that'll either be done with your primary care physician or your sleep physician. They'll need to order a sleep test. You'll either take that at home or you'll do an overnight PSG in a lab, and we'll get that result back and that diagnosis. Once we have that diagnosis, we can start the process. We first take photos of everything, then we take measurements with a pharyngometer and a rhinometer, and we get some nice readouts. These readouts tell us how far we need to advance your mandible in order to get clearance so you can breathe at night. A lot of people will notice that their blood pressure decreases and they might be able to get off their medication. Other people notice that they start to lose a lot of weight. Sleep and the sleep cycles are very important at night, and when you're not breathing a certain number of times per hour, that's significant, and we want to treat that patient. I really enjoy my job as a dentist, but most of all, I love working with people. Dentistry involves a lot of tedious activity, but let's be honest, people don't like coming to the dentist. So what I enjoy most is a lighthearted approach, making sure that everyone has fun, the assistant, my patient, and myself, because what we want to do is create a positive experience for that patient. Dentistry is an uphill battle. Everyone knows it. People who come through and they've had bad experiences as a child, they don't like coming to the dentist. We want to make sure that they have that positive experience so they can refer their friends, their family, and we can get dentistry back on track to fun and happy again.